I just got a notification. Let me read it out. Hi, I'm sad to share the news written by Dominic Barter, President of the Center for Nonviolent Communication Board. It is with great emotion that I write to tell you that Marshall Rosenberg passed from his life 3 days ago on Saturday, February 7th, 2015. It was recently discovered that he had late-stage prostate cancer. He passed peacefully at home with his wife, Valentina, who shared the news a few minutes ago, and all his children by his side. I know no way to describe the impact this man has had on so many people, for his work, for his being, and for the extraordinary power the balance between these two unleashed. He was a beloved teacher to countless people on every continent, people whose hearts were touched and shone with the possibility his work made tangible. To many of you reading, he was also an inspired and inspiring colleague who changed the course of your lives and brought an inestimable sense of meaning and the potential for transformation to every area of your world, and who at each moment did this with utmost simplicity, humility, and humanness. In great mourning and with the most profound reverence and soaring gratitude for the spirit he released in us and those whose light we carry forward. That was the message. But prostate cancer. So let's look up the leading cause of prostate cancer. I think we know the answer to that one. There's many more stages of disease before it becomes prostate cancer. Obviously, Marshall Rosenberg wasn't practicing natural hygiene. Was he aware of it? I don't know. Didn't get the opportunity to ask that. I pulled up the prostate page. Enlargement of the prostate. Prostate gland is part of the male sexual system. It is a somewhat conical-shaped body about the chestnut size. Surrounds the first 1.5 inches of the urethra. Its base is directly upward, lies in contact with the lower part of the bladder. Its upper posterior part is pierced by ejaculatory ducts. The gland itself is composed of muscular and glandular tissue. It secretes a thin fluid which is sent into the urethra to join with the semen. And let's skip ahead and find cancer. Okay. In early stages of the prostatic enlargement, there is incontinence in the urine, dissension in the lower abdomen, constipation, loss of weight, loss of appetite, and dryness of mouth. Back pressure upon the kidneys is produced by the over-descended bladder, gradually reducing their function and protruding, eventually uremia. Enlargement or tumor of the prostate, not infrequently, becomes malignant cancerous. From 10 to 20% of them are said to develop into cancers, and it is estimated that cancer of the prostate gland is present in 20% of all men over 60. Cancer develops out of sites of chronic local irritation and is concomitant hyperemia or chronic lower grade inflammation. Chronic enlargement and irritation of the prostate terms an ideal location for the evolution of cancer. Recently we saw a case of prostatic enlargement that had been giving the man trouble for a period of 6 years. He had ignored it and continued to grow worse. Finally, the discomfort became so great he could tolerate no longer. He went to the hospital for an operation. Cancer was found. A condition that was not cancer 6 years ago had permitted to slowly evolve into cancer. This was a needless and preventable development. The cause of prostate enlargement is said to be quote-unquote obscure, which is the equivalent of saying it is unknown. It is also said to be, quote, apparently a part of the aging process associated with glandular changes that occur in middle life, unquote. If these things were really true, prostatic enlargement would present a truly dark picture. Removal of the prostate, so freely advised and so often performed, is a dangerous procedure and frequently very unsatisfactory. It is not necessary, and our experience with prostatic enlargement has amply proven. While overeating or drinking, alcoholism, exposure to wet and cold, and long continued resistance to the call of nature often precipitate a crisis and are commonly listed as causes, they are not primary causes. Chronic gonorrhea, if often listed as a cause, but this delusion must soon or later be given up. Prostatic enlargement rests primarily upon a basis of chronic toxemia growing out of a mode of living that inhibits elimination. There is reason to believe that sexual abuse may constitute a leading factor in this development. It has been our experience that when toxemia is eliminated, the enlarged prostate returns to its normal size and all symptoms end. Cases we have cared for include those in which voluntary voiding of urine was no longer possible. Catheter had to be used until a few days of fasting produced a sufficient decrease in the size of the prostate that voluntary urination was again possible. A recent case. Our plan of care is to ignore the prostate and eliminate the toxemia, restore the nerve energy, and reorder the sufferer's mode of life. Rest in bed and fasting are accompanied by exercise and sunbaths and followed by proper diet and exercise and sunbaths. We do not use and do not recommend, rather we condemn massage of the prostate, nor any other form of local treatment, drug, electrical, etc. Exposure or overdoing react immediately upon the prostate sufferer. Cold, wet feet, etc. that result in congestion in these sufferers must be avoided. Indeed, every enervating influence must be corrected or removed if nerve energy is to become normal and dependable health be restored. This means that coffee, tobacco, alcohol, soda, fountain, poisons, overeating, etc. must all be discontinued. The permanence of recovery depends upon proper care of the body. Any return to enervating habits will reproduce the toxemia and result in the occurrence of the enlargement. The logical plan to be pursued by intelligent men is to live in a way to maintain good health and thus avoid prostatic enlargement. If the gland has already enlarged, the intelligent man will attend to it promptly and not neglect the condition until acute retention of the urine occurs or until cancer has evolved. So Marshall Rosenberg, if he would have sought hygiene, probably would still be alive. And that's quite the shocking news to hear Marshall Rosenberg's dead. But when people said he was retiring, hey, I suppose the signs were easy to read. And that's what we know about prostate cancer, info hygiene, and how to remedy it. Peace.